Hello, everyone. I'd like to welcome you to today's episode. Our guest today is Dr. Giffe Johnson. Dr. Johnson currently is the program manager for chemical management and health effects at NCASI. He also serves as an editor for Hamilton and Hardy's Industrial Toxicology 6th edition, a renowned reference text originally printed in 1929. And he also serves as past president on the Occupational and Public Health Specialty section for the Society of Toxicology. As well, Dr. Johnson has managed several federally funded research projects as principal investigator. He has presented research at international scientific conferences and has participated in scientific communications with state and federal regulatory agencies. Dr. Johnson, I'd like to welcome you to today's podcast.
Thanks. Nice to be here.
Today we're here to talk about PFAS. It's a very topical discussion of what's going on in the world. For those that do not know, there are lots of chemicals that are under the umbrella of PFAS and PFOA. They are typically referred to as per and polyfluoroalkyl substances, and there are a number of them. And Dr. Johnson has experience and knowledge in this area, so I invited him on here today to discuss them. So, Dr. Johnson, if you could just kind of give a brief history as you know it of the use of PFAS and how chemical manufacturers and downstream companies may have used the materials and why it is of importance or receiving some scrutiny today.
Sure. The use of PFAS compounds has existed since in a large extent in the 1940s and 1950s. We started using these as highly temperature stable compounds for nonstick coatings on pans and pots and things like that. And we found very quickly that they had a number of industrial and consumer uses. They were very heat stable, they were very long lived, they didn't break down easily in the environment or on the products they were intended to be used on. And they confer grease resistance, wetness resistance. They are able to withstand heat. So if we're talking about like its use in food contact materials, you can line a popcorn bag with PFAS and you can cook popcorn inside of a paper bag and not have it catch on fire because you have this very heat stable, grease resistant material there. But also it's on anything that confers wetness resistance. So whenever you get clothing and fabrics and things like that that repel water, typically that has historically been a PFAS compound. We were thinking about things like high performance firefighting foams, and this is where we really get into our current interest in terms of an environmental contaminant. We discovered that Department of Defense sites and throughout the last 30, 40 years had not only been storing these AFFF firefighting foams, which are very high performance and they have a very useful purpose, and on an Air Force base when an airplane is on fire, not just anything will put that fire out. So you need something that is very high performance to put out fires in certain situations in various types of military and industrial processes. But unfortunately, what occurred on DoD sites often was that they would train with these foams and they would not capture the foams and allow them to simply disseminate into the environment, and they would ultimately contaminate the groundwater to some extent. And because of the nature of these compounds, they are fully fluorinated or partially fluorinated or fully fluorinated carbon chains. The carbon-fluorine bond is very strong and very difficult to degrade in the environment, so they persist for decades potentially and take a long time to break down. So our use of these compounds has started to become interesting from an environmental contamination perspective, in the sense that once they escape into the environment, they do persist for a number of years, and they are so broadly used in consumer products and industrial products that we now have a situation where we have at least a small amount of environmental contamination in most parts of the North American continent, particularly in surface waters and soils and things like that, we've become very interested in what the potential human health and ecological effects of that contamination might be. And so we've seen in the last decade or so significant ramp up in both research into the potential health effects and ecological effects, as well as regulatory activities surrounding how these compounds should be used in industry, should be found in consumer products, and how they should be managed as an environmental contaminant.
I appreciate that. That's a great insight and great introduction to the background of it. And I think a lot of what is going on today and what people are observing is, more of a recognition of it. As technology has improved, we're able to detect lower or smaller and smaller amounts of the material. We're identifying that, as you said, there is more distribution of it than maybe what was originally identified in the groundwater, in the soil, in different contamination aspects. Can you speak on the evaluation of those materials and identifying and the sensitivity that has increased in those detection processes?
Sure. So in solids, when we're talking about like products, we're looking at typically the hundreds of parts per billion as a detection limit. For instance, in products that you might try to assess as to whether or not there's intentional addition of PFAS or non-intentional addition, simply from contamination of other, non-related sources to production. 100 parts per million threshold is typically used, and that's on an aggregate basis of like total fluorine or total organic fluorine, so not individual targeted PFAS analysis. Where we've really gotten to low detection limits is in aqueous samples, so thinking about drinking water samples or surface water samples, and we have a couple of new EPA approved methods for that. 537.1 is typically our drinking water analytical method, and there's, I believe, almost 30 PFAS that are targeted in that analytical method. Um, and that method, we can get down into the single digit parts per trillion. And so that, means typically we're looking at a limit of detection somewhere around 4 parts per trillion, sometimes lower, as low as 1 part per trillion. Um, when we're thinking about, surface water, that might be more applicable to a 1633 type of method where you have high solids content, dissolved solids, where you might have to analyze, you have to do some things to ensure that you're picking up the PFAS that are in the aqueous portion of the sample as well as the solids portion of the sample. So it's a little bit different from the 537.1 methodology, and to ensure you're capturing that total amount. I believe 1633 currently has 40 analytes in it, and it is in its draft form with EPA, but it is in, I believe, its fourth draft form, so we should be seeing a final draft of that soon. Both of these methods have some, excuse me, some variability in them in terms of how laboratories deal with the prescribed methodology. There are some different ways in which you can clean up samples and how you should dilute samples before or after certain parts of the sample train process. And depending on the choices the laboratories make, our personal experience has been that you can have some relatively substantial differences in the outcomes of what you get from your analytical laboratory by testing samples using these various choices they have throughout the method. And the impact of this is that we have a lot of data um, from the last 10 years or so for surface waters to give us a sense of what the potential environmental impact from PFAS has been. But that most of that data has been used or has been done using method 537.1 modified. So we remember we said 537.1 is a drinking water method, so it's meant for relatively pristine water, not having high solids content. But they've made some modifications to it to try to adapt that to having surface waters that have some, interfering substances in it. And so those modifications are not always consistent among the laboratories. So it's difficult to understand exactly how accurate a lot of this data that we've been getting is in the last 10 years. But we certainly see a range from low single digit parts per trillion in our surface waters to sometimes double digit parts per trillions. And in rare cases where there's been heavy contamination, we might see hundreds of parts per trillion, and in some very rare cases, even parts per billion.
And I appreciate that information and that explanation. I think this is where the want and concern for human health and human exposure comes into play with the introduction and identification of these at such low concentrations. And I mentioned it earlier. Dr. Johnson is one of the editors of Hamilton and Hardy's Industrial Toxicology. He is a trained toxicologist. So I'd like to get into kind of discussing generally the health effects, the short or long-term health effects that have been postulated for PFAS exposure, and why the detection of these materials at such low levels is being highlighted to understand what people actually are internalizing and what the human health risks may be from ingesting those materials with such low levels of PFAS in them.
Right. So there's a variety of health effects that are being investigated currently for various types of PFAS. It's important to understand, too, that PFAS is a very broad class of compounds. And so depending on which definition you use, some regulatory agencies are using a two carbon chain fully or partially fluorinated substance, or some are even saying one partially fluorinated carbon can constitute a PFAS compound. But they range in the carbon chain length, so they can be as much as 1 to 12, 15, and depending on some of the larger polymers, they can be very large. Um, and they can range in terms of the functional group that is attached to the end of that carbon chain. So predominantly we think about like the carboxylic acids like PFOA, or the sulfonamides like the PFOS. So depending on those two components, the carbon chain length and the functional group, you can have a variety of characteristics for these compounds in terms of their fate and transport in the environment, how they get absorbed into the body, how they're expelled from the body, their rate of breakdown, the what tissues they preferentially bind to. So there's really a lot of individual toxicity characteristics for each one of these compounds. So I just want to make that clear from the outset that when we talk about the toxicity of PFAS, we're really talking about toxicity of individual compounds within that class. And it doesn't really make a lot of sense to group them all together because they have typically different toxicological endpoints and significantly different dose responses depending on their individual configuration.
I think that's a great point. Not to interrupt you, sorry.
Thank you.
Is there is this want to group all of these constituents together in one group. And I'll give you the example that you were just discussing. In the Toxic Substances Control Act, there are approximately 500 chemical abstract service or CAS numbers for PFAS chemicals. As you said, there's lots of different configuration changes that can occur, and the regulators are wanting to put these all into one group, and that makes it difficult for the evaluation, as you said, with different toxicological endpoints. So with that information provided, how can these short and long-term health effects be evaluated? Is it better in your thoughts? Some of them, and we'll get into this a little later about different thresholds that have been established. But are some of the individual PFAS constituents, I'll say, causing health effects that are more concerning than others? And how are we viewing, or how are we evaluating those short versus long-term health effects based on the variety of different PFAS that can exist based on their historical use and deposition into the environment?
Right. So it largely depends on data availability. So we have a lot of data for PFOA and PFOS. There are two very common 8-chain degradates of big polymers that were used for a number of decades in this country. And so we've done a lot of toxicological testing for them. There is also some epidemiological evidence for these substances. And what we know about them toxicologically is that they have a pretty clear mechanism of action. They're peroxisome proliferase activators, and that produces a very well characterized liver toxicity. To some extent, we know it's related, it can be related to some cardiovascular toxicity. But these effects occur typically in the parts per billion contamination level of ingesting water in terms of these animal studies. And so, what we saw as a result from those types of animal studies, we would get into regulatory values in the hundreds of parts per trillion because they have a margin of safety built into them, so they're lower than what we actually, find in the studies. So it's a very well characterized disease pathway from exposure to these chemicals, but it occurs at a much higher dose. So what we're finding now is some scientists are trying to build an evidence base for other types of outcomes like the thyroid issues, the recent EPA health advisory levels from a few years ago. They were based on some developmental issues such as seeking behavior in rats and rodents. And those are less well characterized. There's not a very clear mechanism of action for those, but there is some toxicological data that is suggestive that those effects might occur at lower doses than what occurs for liver toxicity, which was, what the primary health levels were based on before that.
Right.
And more recently, people have become interested in some epidemiological evidence for immunotoxicity. This is a lot less clear as to what the actual impact for things like PFOS, PFOA are on immunotoxicity. The characterization of immunotoxicity that they've been using is the finding that some after vaccination for some types of vaccines, they would see some lower antibody levels in individuals who received that vaccination that had higher levels of PFOA or PFOS in their bloodstream. The problem with these studies, though, is antibodies are sort of like blood pressure, right? If you measure it 3 times a day, you're going to get 3 different numbers. And so if you just take this sample of, an antibody level and a PFAS level at one time, it's not going to be very clear what that means. The other thing is there's no evidence that any of these folks that had any of these antibody measurements were more or less susceptible to the disease that they were being vaccinated for. So the basis of these studies is not actually a clinical outcome. It's that they didn't receive any disease as a result of the PFAS that was measured in their bloodstream. So it's difficult to really understand whether or not this is a real effect. This is something that needs to be studied further characterized. But the issue that we are concerned about from these studies is that these findings occur at very, very low dose levels. And so that is the primary reason why we have seen this evolution from 100 parts per trillion levels that we think were safe when we were focused on liver disease down to slightly less than 100 parts per trillion when we were focused on these developmental thyroid effects, and then down to single parts per trillion levels that people are suspicious of for these immunotoxicology effects. So that's the evolution of, for at least PFOA and PFOS, where we are sitting.
No, and that makes sense. I know there are a variety, as you said, there are a variety of different outcomes that people have evaluated and attempted to identify. And again, it goes back to your statement earlier: is lumping them all together makes it difficult, because you need an understanding of what constituents may be evaluated or may be in a contamination scenario to determine whether or not you're comparing apples to apples when you're doing a risk assessment, to make sure that you're comparing it to reasonable thresholds for what you're doing. Another thing that is interesting, again, as we talk about detection levels, is there has been an increase or a more sensitive evaluation of those constituents in human samples, in blood and serum samples, to identify those at lower levels. So previously, where again we may not have seen those levels when we're taking a human sample, we are maybe now seeing them, and that's aiding in this association, pardon me, that people are identifying and saying, oh, well, these outcomes must be must be the causative agent, because now we're seeing them whereas we did not before, and now we're able to kind of make these jumps, I'll say, to link these two outcomes together, the exposure and the outcome.
Sure. I mean, it's fairly problematic because a lot of these types of outcomes are fairly chronic diseases, but also because we've phased out largely these longer chain PFAS compounds over the last few decades in most materials, we've actually seen, if you look at the NHANES data, it's the CDC's collection of various types of biological data from people, the survey data, those sorts of health related statistics and data. We've actually seen a drop in PFOA and PFOS and some of these longer chain chemicals in people's blood and other biological matrices. So, conducting, if you're trying to establish a relationship between these two things, but you're using, health data from today and PFAS data from 20 years ago, or vice versa, you're going to have a hard time making that relationship make a lot of sense because there actually has been a substantial change in those concentrations. And and like you say, as we go forward now, the detection limits of these substances continues to drop as our analytical chemistry methods become more sophisticated. So we are, thinking about, what our real exposure was in the 1980s. If you're going out and looking for environmental data, that the limit of detection may be an order of magnitude or more higher at that time for looking at environmental data than they are today. So you may get non-detects in certain areas in the 1980s when we were sort of at our height of, 8-chain PFAS environmental exposure, whereas now you will be able to measure them down to the single parts per trillion. So there's some challenges there in interpreting environmental data and how that has changed and how that has potentially impacted health.
So we've kind of talked about the toxicological endpoints, the hepatotoxicity, the liver toxicity, any developmental effects. But one also thing that has been found by EPA in a recent assessment is the longer term risk of cancer development. I'm just going to read you this information from an EPA document that was published this year. Identifying the suggestive evidence, it says EPA has determined that PFOA and PFOS are likely to cause cancer, for example, kidney and liver cancer, and that there is no dose below which either chemical is considered safe. And they've lumped this analysis together in their overall PFAS analysis. So I'd like to just generally kind of give an overview of, the information that EPA may have been relying on or looking at for this evaluation, and the statement that there is no safe dose of exposure.
Well, I guess that gets us into some specific data for PFAS, but also some general comments about how we evaluate health effects in a regulatory context. So for PFAS, there actually is some emerging animal toxicology data, which is the higher quality of data as compared to epidemiological data, and we'll talk about that in a second. But for an increase of tumors in PFOA studies, the PFOS data is, I think, a lot less conclusive, and there's some challenges in interpreting some of these studies, but the evidence is stronger for PFOA, I would say, than there is for PFOS, even though I believe that they're considering both of these to be likely carcinogens. So one of the reasons why we rely on animal toxicology studies for regulatory development as opposed to epidemiological studies, which increasingly is being used by EPA to be the focal point of regulatory development and developing actually threshold levels for regulation. So in an animal study, you have two groups of animals and they are treated exactly the same. They have the same day and night cycle. They have the same food, they have the same water. They have the same living conditions, the same stressors. There's not a group of mice that are smoking versus a group of mice that are not. So that all these environmental conditions, these behavioral conditions, they're all exactly the same. The only thing that's different between these two groups is the dose of the chemical that you are giving them to test their toxicity. So the one major point of uncertainty for an animal toxicology study is whether or not it extrapolates to humans, because rats are not people. There potentially are differences in the way that their bodies treat a chemical and exhibit toxicity. On the other hand, an epidemiological study, that is the one point of uncertainty that's removed, right? Is that you know that humans are the subjects in that study, and so it's relevant to humans. However, within the human populations that you are measuring, unless you explicitly measure and control for these things, you don't know if, how many people are smokers, are obese, are have a variety of other factors, if their occupational exposure is impacting their cancer risk, if their genetics are impacting their cancer risk, you know, where, what other types of environmental pollutants they might be exposed to, or anything along those lines. So some studies do control for some of these things, and that helps. But at the end of the day, particularly when you're looking at the lower end of the dose response curve and you're looking for very small changes, it's very difficult to have high confidence in a cancer study that demonstrates very low changes of cancer incidence between populations, even if there is uh, differences in their PFAS or whatever target chemical you're looking at exposure level. So there's issues of reliability with the epidemiological evidence, and it's particularly if they don't tie back to the toxicological evidence in vivo studies in animals that corroborate that evidence. It's sometimes hard to know exactly what's going on. And the problem with the way we regulate carcinogens as opposed to non-carcinogens is that for non-carcinogens, we assume that there is a threshold, that there is some level below which anyone can be exposed to a chemical and not exhibit health effect. For carcinogens, we make an assumption, which is basically a regulatory policy assumption, not a scientifically based assumption, that there is no threshold, that there's potential risk all the way down to as close as you can get to zero without being zero. So the only way you can get to zero risk is to have zero exposure. So because we make that assumption, we typically take data that is very high on the dose response curve to make our extrapolation to what might be a dose response at a very low level. And it can be several orders of magnitude. So we may be making assumptions about what the risk is at a 1 in a million risk level from a study that was really done in 100 animals or 100 subjects in an epidemiological study. So you're looking at a 1 in 100 risk and then trying to extrapolate what a 1 in a million risk might be. And so because you've made that assumption of no threshold toxicity, you are likely to get, well, you're guaranteed to get calculable risk, even though the risk may be as low as zero at that dose range.
Right. No, and that makes sense. I mean, that's kind of the how these types of studies go. And when they talk about there is no level which is considered safe, a risk calculation can be done, but as you said earlier, not only is there an extrapolation through that low dose, but there are also safety factors that have been built in this evaluation. As you said, extrapolation from animals to humans, variability in the population. There are lots of things that go into doing a carcinogenic risk. So one thing that you brought up was epidemiological studies. And I'd like to get in a little into that because there are those studies that have been done on populations from, I'll say, kind of two different exposure scenarios. One is the manufacturer exposure scenario. There are manufacturers of these products, of PFAS products, that are used downstream in other manufacturing type scenarios. So there are epidemiological studies of those manufacturers or downstream manufacturers, and there's also very limited epi, as you said, from NHANES data. For evaluating exposures in the general population. So are you able to somewhat talk about what the epi studies are, the types that are out there, and I'll say the strengths of limit and limitations of those studies based on the population that they are evaluating. Again, you mentioned earlier the control is an important factor that goes into animal studies, which may be lacking in epi. But I'd like to expand on that related to PFAS, because there's also, there's the occupational kind of type of exposure, and then there's the general population type of exposure to this material.
Right. So I believe there are a few occupational epidemiological exposures, but the problem with those occupational cohorts is that the exposure levels are very high. And so it's difficult to extrapolate what the outcomes might be in the general population from looking at what we see in an occupational exposure. And that's, where we find liver toxicity and things like that that occur at those very high exposure levels. And when we're looking at the general population, there are a few ongoing cohort studies that are looking at what long-term exposures to very, very low levels are potentially. I don't think we have good conclusive evidence on those studies yet. There have also been some of the sort of cross-sectional studies that, like I mentioned, the Faroe Islands studies looking at antibodies and the one-time sampling of antibodies versus the one-time sampling of the PFAS blood level to see if there's a relationship between those two things. But those are extremely problematic because not only is there a high degree of variability in the outcome that you're looking at in terms of like antibody concentration, without a sort of a temporal relationship to see, you know, you can't establish that necessarily in the same person that as a PFAS level increases, antibody production becomes less, or whether or not other factors that confound antibody production are taken into account. If you look for, I believe CDC has some guidance on looking at antibody production, that there are a number of factors that can confound antibody production, such as simply having a cold, having other types of environmental exposures around you, depending on if you're living in a place that has cleaner drinking water versus less clean drinking water, things like that. So if you're exposed to other environmental pathogens and things like that, that can impact your baseline antibody response. So without taking into account many of those things that influence that, it's really hard to know if small changes, like in some of these studies, as low as a 5% change of antibody response, is really related to these chemical differences that you're measuring or to any of these other things that impact that outcome.
No, and I agree. And depending on the manufacturer and depending on even the exposure scenario there, there may be in the study there may be in an occupational setting, people may have a variety of exposures. It may not also be PFAS. They may work in different portions of the factory and do different things, or just have different exposures on chemicals that are being manufactured there. So I think that's an important distinction as well, is understanding how regulators are relying on this information, what information there is, and how you can best interpret it. Because again, as you said, when you're looking at the cross sectional, that's just a point in time. You're not looking for trends, and what are all these trends kind of telling you? Earlier, we had talked about PFAS toxicity and the mechanism of toxicity. Based on, I'll say, some of the studies and the importance for exposure monitoring. Now, a lot of the focus has been lately on drinking water and talking about the MCL, maximum contaminant level, maximum contaminant level goals, MCLGs from EPA. Is there a way that you can just kind of discuss, the importance of identifying these materials, PFAS, in drinking water, what that means for any potential for bioaccumulation within the human body, and why it's received such scrutiny lately? And I see news articles all the time of, the PFAS detection in drinking water. What does that mean? Now, if there's MCLs, you're going to have to control for that. What does that mean for the end user, for the person who's turning on their tap in their home, as far as risks and how should they interpret this information?
Right. Well, I think the title of forever chemicals in your drinking water is getting a lot of clicks. So we're seeing a lot of those types of titles posted on various types of websites and things like that. Um, There's been an interesting evolution in the MCL process, and I think it's been very convoluted and very hard for uh, the common person to understand, what the real risk is here. So before we had the MCLs for PFOA and PFOS, we had the health advisory levels from EPA, which were 70 parts per trillion. That was a level that was suggested to say, if you're below that, or if you're above that, rather, you may want to consider some cleanup options. And, it was used as guidance to sort of indicate, where we thought there was a good threshold to think about some potential action if you get above that, because it was protective of these, questionable, but some evidence for developmental effects and thyroid effects and things like that that were um, being evidenced in studies at that time. So, as the EPA went through the MCLG process, which is the maximum contaminant level goal, so these are non enforceable uh, levels, but they are considered goal. If you are identified as a carcinogen, the goal is always 0 for those. Otherwise, it's a very, very conservative estimate for non-carcinogens that are considered to have a threshold of toxicity. When the EPA went through that process for PFOA and PFOS, they focused on these antibody studies from the Faroe Islands, and which occurred at basically the close to the limit of detection in those media for PFOA and PFOS, and that brought them with an addition of the margin of safety built into these levels as to like parts per quadrillion level MCLGs. So again, not enforceable, but this had an important impact on EPA's treatment of the health advisory levels. The health advisory levels are supposed to sort of be based on what's the lowest regulatory limit that we have across various EPA agencies for this type of material and the matrix that we're interested in. And because they got to these parts per quadrillion levels for PFOA and PFOS in the MCLG process, they adopted those for the health advisory level. So now folks who are thinking, well, 70 is something that, we can protect public health. We can get to that level. That's something that's manageable. We can do that. Now they've gone from 70 parts per trillion to parts per quadrillion levels, which are not measurable. And that's below the limit of detection. So not only can is it likely to grossly overstate the health risk that potentially is posed by chemicals in water, in drinking water for, these particular substances. You can't manage that risk at all. You can't create a risk management plan based on something you cannot measure. So the MCLG process settled. Everyone sort of suspected that, these health advisory levels are probably not going to be long lived simply because they're not particularly useful. So now we've completed the MCL process, and the MCL process got us to more measurable limits for PFOA and PFOS, and it also used a hazard index for some additional PFAS, which we should talk about a little bit. For PFOA and PFOS, I believe we got down to 4 parts per trillion, and so 4 is measurable, but again, if you are creating a risk management program for drinking water, you don't want to start doing something at 4 parts per trillion, right? Because now you're right at your regulatory limit. You wanted to be doing something at an action level that's maybe half or a little less than half, like 1.4 parts per trillion. And so if you can't measure 1.4 parts per trillion, that's not a very useful action plan, right? Because you don't know when you've gotten to your action level. So again, these levels are so low, they're really challenging for risk managers to, create a program that they can actually operationalize in terms of protecting public health from these chemicals. And again, these chemical limits are based on this idea that they are carcinogenic, and now that PFOA and PFOS have been listed as likely carcinogenic, they now fall under a 0 MCLG rule. So that changed the MCLG. And I do want to mention, before we get too far out of the MCL world, this idea that they had about using the hazard index as a way of trying to group some additional PFAS under the MCL. So they have, I believe, PFBS and 4 or 5 other PFAS compounds that are grouped. They're varying chain lengths. They're of varying functional groups in terms of how they're structured. And so they have variable toxicological endpoints. They don't cause all the same
Hmm.
health effects. They don't cause
Right.
those health effects at the same dose response rate. Typically, when you use a hazard index approach, you are trying to add up various substances that have a toxic effect on a similar endpoint. So if liver toxicity was your endpoint and one caused a little bit of liver toxicity, and the next one caused a lot of liver toxicity, you might add those two up to say this is that combined effect, and we want to stay under the combined effect. Well, for these compounds, EPA said, this is a feature, not a bug of this new implementation of hazard index that we don't need to have common endpoints. And so we'll just add them all up because they are PFAS and likely to be the same. So there were during the comment process of this MCL development, there were a lot of people that made the comment that that's really not an appropriate way of applying the hazard index, and we should really be thinking about a better way to treat these chemicals. So this is an issue that we are continuing to deal with in the sense that there is a regulatory desire to group these chemicals for some sort of simplicity of policy, but there's
Hmm.
a scientific ad, uh, adversity to doing that because it simply doesn't match up with the data and the characteristics of these chemicals in terms of toxicity and fate and transport and biological interaction and all of those various things that we consider.
Right. No, I mean, that makes complete sense. And it makes it difficult, I'll say, from a drinking water perspective of, what if a public water utility has to evaluate these chemicals and these constituents, as you said, how are they managing the risk? How are they evaluating this? And what does the risk actually mean? You can have a theoretical risk that you calculated, but it may not be anything, I don't want to say meaningful, but it may be have so many safety factors that are included in there. It's not an appreciable kind of risk to evaluate. So you mentioned the regulatory framework. You mentioned how the EPA is viewing this. Are there beyond EPA? I don't know if you've had the opportunity to look at other regulatory findings and evaluations of these. You've discussed how EPA is viewing these. Are there other regulatory bodies, whether it's domestic or international, that you know of that may be evaluating them in a different way, not grouping them all together and actually looking, as you said, the common mechanism of toxicity, and viewing them as the constituents instead of the whole?
Well, it's a little bit all over the place. So there's many states during EPA's 70 parts per trillion has health advisory level period thought that that level was not conservative enough, and so they went through their own process to develop some individual levels for some targeted analytes, and it was typically a list of anywhere from 6 to 8 to maybe 14 various target analytes that they came up with. Lower numbers than 70. They could be as low as 20 parts per trillion down into the single digit parts per trillion, depending on which state and which type of matrix you were looking at. So there are many states who have individual target analyte values for certain PFAS, and this particularly relates to dischargers who are discharging materials into a water body, and these can potentially make their way into a permit. We haven't seen a lot of that happening, but this is something that's increasingly happening. With the addition of 1633 method from EPA, we will likely see more NPDES permits requiring some measurement of PFAS, if just PFOA or PFOS, as maybe as high as all 40 analytes that exist in that. So we're continuing to watch that, and I think that we'll see an increasing desire to measure and regulate permitted facilities for discharges of these levels. There's other, the World Health Organization is using, I believe, in the hundreds of parts per trillion, or let me see. Well, we should look this up. World Health Organization has um, it has, I believe, 100 parts per trillion for PFOA, PFOS combined, and then also something like a 500 or 600 parts per trillion for a total aggregate PFAS value. But you should check me on those numbers. I may have gotten those wrong. Um, we still see some substantially higher values, like in Australia, they're in the hundreds of parts per trillion for PFOA and PFOS. Canada recently has gotten interested in regulating PFAS, and what we're seeing from them is a desire to group and a desire to perhaps use a lower value than World Health Organization for that grouping of approximately 30 PFAS or so. And so they're still working through that process, but they are certainly at that perspective of we should, group these up and try to regulate them in the aggregate. So we're seeing a lot of diversity in how people are approaching the regulation of these substances, and there are various levels, I believe, of good and bad in terms of the scientific robustness of how they treat individual substances, as well as what they identify the need for additional conservatism to be in terms of what the margin of safety should look like between where science actually says, yes, there's some significant health outcomes we should be concerned about, and how far under that level the regulatory value actually gets us to.
Sure. And just to provide context, it looks like based on the World Health Organization, they've proposed values provisional of 100 parts per trillion for individually for PFAS and PFOA, and combined, it looks like 500 parts per trillion total for PFAS. That's interesting, and I think this, you pointed this out, and I think this is an interesting thing to point out is, it's not only the drinking water that you have to be concerned with. It's about the effluent from manufacturers or other types of facilities that are discharging this water into water streams and waterways. That and you can speak a little on this too. Is they treat and clean these waters before they discharge. They have permits. They have thresholds that they have to meet, and this adds, I don't want to say it adds a burden to them. But it also makes it difficult in that scenario. And I don't think a lot of people really think about that discharge event that it occurs. People don't discharge like they did in the 70s. They have to take care of things. They have to ensure that there are thresholds that are met. And as you said, there may be some of these scenarios where the thresholds are such that they either can't meet those numbers or can't even possibly even detect those numbers, as you said, for an action level earlier.
Right. So a lot of the concern actually relates to the ubiquity of PFAS in the environment. So if you are receiving water from your raw intake that contains PFAS, it comes out into your effluent. And
Hmm.
if your state is limiting you to 8 parts per trillion, that may simply be what's in your surface water that you're having to deal with.
Right.
So that can be a pretty substantial challenge. And when thinking about how you deal with something like that, municipalities that provide finished drinking water to clients in their city and their region, um, are constantly thinking about how do they get rid of that. The remediation technologies that we have currently are kind of inefficient and expensive. And so for the difference between going from, 70 to 8 could be very, very substantial in terms of cost, and maybe so much so that it's not feasible cost wise. And so we do need to think about, are we cleaning up these materials to an extent that is actually providing additional public health protection? Or is it, are we not spending that money very wisely? Are we spending money on something that's not conferring any public health benefit to anyone? So I think it is very important that we continue to explore the science of the actual toxicity of these substances and understand where we really need to be to confer public health protection.
No, I completely agree and understand it because, you know, as you said, those and the mitigation technologies, and I don't know if you're able to speak to that a little bit, what those are, but, you know, it goes into, as you said, what's coming into the building. You know, there are new standards that, you know, for, I'll say, building as an owners and operators, when you're talking about an office building, whatever, that have a requirement to ensure the safety of the water entering the facility. You know, is this something that they're also going to have to potentially look at? Is, you know, what are the PFAS levels? What are the people being exposed to in this facility? Is there even a realistic risk? Because again, you know, there may be maximum contaminant levels, but nothing's, what is potentially accumulating or being gathered between the distribution point for a public water utility and the end user. You know, are there, as you said, are there even technologies on the somewhat consumer level that would even remove these materials? And is it even a cost-effective methodology?
Sure. Well, a good example of concerns that individual facilities might have is some large industrial sites provide finished drinking water to the workers, and so they are subject to the MCL. So they may have to achieve that level of cleanup in order to continue to provide that water to the workers or anyone else that comes on site. So in terms of remediation, traditional technologies will work, but they're kind of expensive and inefficient. So granulated activated charcoal, that's something that is sort of a all-purpose cleanup of a lot of different kind of chemicals and wastewater.
Mm-hmm.
But the problem is because it grabs so much other stuff than PFAS, you know, if you're trying to go from 12 parts per trillion to 8 parts per trillion, you're going to use a lot of granulated activated charcoal in order to get down to that level because there's so much interfering substances that it's also pulling out that it's going to be very, you know, that you're just going to have to use a lot of volume for that. There's a lot of use of resin ion materials that will grab PFAS in a similar way. But the problem with those kinds of technologies is it's typically used in the context where you want to recharge that resin. You want to send it out, have it cleaned up, and then put it, you know, back in and do that. With PFAS, you can't really recharge them so much. You typically have to destroy them the same way you would the GAC. And that presents actually another problem with it. You know, these are heat stable compounds, right? So to incinerate them, you need a very, very high level of heat to destroy that carbon fluorine bond and actually get rid of them. You're then concerned about air contaminants if you're doing that from some sort of incineration perspective, or what else do you do with them? So once you grab it out, what do you do with it? And that's a sort of one of the current problems. Same with reverse osmosis. Reverse osmosis is very effective, but it's very expensive if you're doing a high volume of water. So a municipal water treatment plant or even a large industrial facility that's discharging lots and lots of water, you're going to have a hard time justifying the costs for that reverse osmosis. And then again, that is going to create a slurry that has a high concentration of PFAS in it. What do you do with that? You got to figure out a way to then get rid of that. And as we see, you know, PFAS fall under RCRA and CERCLA and things like that, many of those things are going to be now classified as hazardous waste. And so you're going to have to deal with them under that context. So
What? Yeah.
there's a number of experimental and emerging technologies coming down the pipeline, but as far as I've seen, none of them are at scale to an extent that they work as well or better than the existing technologies.
What's interesting is I think this is a good example of, you know, when you make changes to control something that's in the water like PFAS, it's always going to have different downstream effects. So, for example, if you're using activated charcoal or carbon, you have to maintain a disinfectant level in there as well. You know, is that going to be impacted? That disinfectant level going to be impacted by the actions while you trying to remove PFAS? Is it more risky for you to provide potable water that is lacking disinfectant versus potable water that has efficient disinfectant in it, but may have small amount of PFAS in it? As you said, again, the hazardous materials. Now you have to treat it, classify it a different way. It has to go to a certain facility. You have to handle it differently. There's always downstream effects. And I think the overall thought is, you know, is the risk presented by these materials such that the actions that we are taking are worth it? You know, there used to be, for example, as we were talking about MCLs and evaluation of those, there used to be a component of that economic feasibility in achieving those MCLs, and I think that has kind of been pushed to the side. Say, well, we're thinking more of the end user health risk instead of the economical or realistic feasibility of establishing an MCL based on what is technologically feasible and appropriate and reducing health.
Sure, and that's a challenge for industry, and I think that's an important reason why consultants in industry and especially academic researchers who have looked at this and think that maybe there's some room for a better characterization of some of these issues to engage with EPA during these comment periods and it- help them to understand that we should look at all of the uncertainties and potential biases and what is the best most robust science we can look at to make a high quality determination of where we balance that protection of public health, margin of safety, and economic output. I I've had many conversations with folks who would like to get a permit extension to do a new project, right? So they want to change their permit to do a new project, but as they're being compressed by lower and lower levels of discharges and things like that, it's very difficult to expand a project, which we claim, and I think in this country and in sort of a bipartisan way, that we're trying to expand our supply chains, right? We're trying to build new infrastructure. So if we don't have the headroom in our permits to build out new infrastructure, be very, very challenging to meet those goals. So we really do need to take a vested interest in not just saying let's have a race to zero on what we think the toxicity of these chemicals are, but let's have a very nuanced and robust discussion of what's the best science tell us, and try to balance out those things because we all want protection of public health. That's nobody wants to say let's let toxic chemicals into the environment in a way that's going to harm our family, but we also want our economy to be strong. So we need to find a very high, robust scientific basis to establish those levels.
No, and then that makes perfect sense. Having something scientifically defensible to support these establishment of these thresholds, and I think that is, where kind of where things are going. So, do you see on the horizon as far as any regulatory or filling in any data or knowledge gaps of this? Have you been made aware? Have you seen anything where we may be going towards the ability to further delineate the risks of the individual PFAS and have something that may be more scientifically defensible if people are interested in reviewing permits? Is this something where an individual permit seeker can say, there's new research out there, I've done the risk evaluation, and actually this shows that there's a decreased risk, I'd like to present this as something that I'd like you to consider based on current science in allowing that permit? Where do you see the current and future regulatory and research framework?
Well, I think states have taken a lot of action on PFAS in the last 5 to 10 years, mostly in the last 5 or 6 years, I would say. And I think we're starting to get some experience of what the impact on industry is from those actions. So I think there is a vested interest now in states taking a look and saying, okay, we don't want to destroy our economy by having a level that's unnecessarily low, that is not providing additional public health protection. And so I think states, as they move forward, are going to take a more nuanced look at, looking at individual chemicals and trying to find a happy medium where we get to that balance. Although there are certainly a very vocal group of people that believe that there is a substantial basis of evidence for low level regulatory values, and the folks that are conducting these epidemiological studies, and some groups that are doing some additional animal studies. We're going to see a lot more data coming forward in the next few years that is going to continue this scientific discussion and argument, I guess is a legitimate way of saying it, that where do we fall? But that's how science works, and that's okay.
Right.
It's good that we get more data. we want to be cautious about what the quality of that data is and interpret it appropriately, but we want more data and we want to get to the right answer. So I think we will continue to receive more data. We'll have to be cautious how we interpret it, but ultimately, hopefully, we will get to a place that brings us that proper balance of protection and industrial viability.
I love to get to that balance. I think that's a balance that's needed many times. The levels that have been established go down; they don't go up. But there have been those small instances where thresholds have been changed based on current science and current understanding, and hopefully, this will be one of those scenarios. Any leaving thoughts for us today on PFAS exposure, health risks? I know we've covered a lot today, and it's great information. I thank you. So is there anything that you'd like to leave this discussion on any listeners for any risks that they may be considering or thinking about with PFAS in the news?
Well, I would say, take all the clickbait with the forever chemicals, killing your neighbors with a grain of salt. It's probably overstating the situation. Keep in mind that the quintessential proposition of toxicology is that dose response is what's important, not just the presence of a chemical. It's how much for how long. And we want to, keep in mind that we take a calm approach to regulating these substances and, managing these risks, but also that PFAS is a very quickly evolving issue in this country and internationally, and we're going to continue to see regulatory developments and like land applied biosolids, very important for municipal wastewater treatment facilities and other types of industry that land apply their biosolids that come out of their facilities. That has a benefit to agriculture and things like that. But we're going to have to consider what that balance is for what we land apply and what gets potentially into the groundwater and those sorts of effects. Where I've been to scientific meetings where there's concern about PFAS and recyclables. And some people have suggested maybe we shouldn't recycle anymore. Like, is that really the balance that we want to get to? I'm not sure. I'm sure that that's where we want to get to, but
Right.
it's going to be a concern. It's going to be something that people are going to ask that question. And again, I think we should be very concerned about throwing away good things for the benefit of getting a few parts per trillion extra margin of safety that probably doesn't improve anyone's health. And let's see, I mean, just thinking about other matrices, the next big thing I think that's coming down the pipe too is the impact of air deposition. I don't think anyone's been suggesting that an inhalational exposure route for PFAS is important, but people are being concerned about what is the impact of air deposition on water bodies to contribute to the overall impact there. Of course, product stewardship for PFAS is going to be a quickly changing area. We've already seen California institute a couple of rules. They've gone to 100 parts per trillion for the identification of intentional addition of PFAS for, I think, food contact materials, and as low as 10 parts per, not trillion, sorry, million. 100 parts per million for food contact materials, 10 parts per million for feminine hygiene products. And that basically is the limit of detection for the total fluorine method. We're also seeing, a lot of complications with the total fluorine method in terms of, what the accuracy, repeatability, reproducibility of those results are. So we want to continue to be mindful of what the toxicity discussion is, what the regulatory discussion is, and what the analytical method discussion is, because that will become very important in terms of knowing what your situation is and whether or not you're being compliant with state and federal rules.
No, and I appreciate that. I mean, I think you get a lot of good information there. I think it is something that I don't think is well explained in the current news cycle, and I'm hoping that the information you have given us today is going to help some people and help with that explanation and make them understand or help them understand what the differences are, what the real risks are, what those levels actually mean. So, Dr. Johnson, thank you so much for joining us today. We really appreciate your time.
Thanks for having me. I appreciate it.